See students here, faculty members, alumni. It's really great to see everybody here. Some staff members. Welcome, everybody. Hope you all are doing well on this rainy spring day. At least it is very much rainy here in Columbia.
Same here in DC.
Yeah.
Very gray, very wet.
Yes. It is springtime. Warm weather is coming, but maybe a few hazardous weather days before we get there. It actually, there was snow this morning here and we had hail yesterday. Wow. So it's exciting, but fortunately no tornadoes or anything.
Oh, that's good.
Right around here.
That's good. Can I just take, since we're waiting, I just want to say hi to Martha Pickens, who I see has joined, who's wonderful, who was amazing throughout my time at Mizzou, and I just want to say hi. Hi, Martha.
Hi, Martha. Martha, it's good to see you.
Rhitu is one of my favorite ever students. She's
you're
the best. And I still remember the day you walked into the office, Rhitu, and said,
with Vanya,
I think maybe I should be over here rather than Bond Life Sciences. And I thought, yes, I think you should be. I think you'd be a perfect fit. So I was always so glad you were one of our students, and I love seeing all of your success.
Thank you, thank you. Indeed. That was an instrumental conversation in sort of encouraging me to apply.
Yes, it was, wasn't it? It was,
yes.
It was perfect. It was one of those great confluences, you know.
Yes, indeed.
Yeah.
I see Berkeley has joined. Hi, Berkeley.
Just joined.
Hi, how are you? Great to see you.
Great to see you too. Thank you so much for coming.
Yes, I'm sorry I can only be here for half the time.
That's all right. I really appreciate you joining.
Well, this is amazing. It's kind of like reunion day. So it's 11:05. I know people will continue joining, but let's go ahead and get started. So I am very excited to welcome all of you to this semester's Smith-Patterson Science Journalism Lecture. This is a lecture series that we've been doing for 4 years now, I think, Holly, where we've worked with the Pulitzer Center to present speakers talking about their work in science, health, and environmental areas. This lecture series is funded by Russ and Gail Miller, and we're so thankful for their support. They weren't able to be on this call today, but I believe we're going to be recording this. Is that right, Holly? Is that right, Holly? And we'll provide that recording to people who weren't able to be here in person. So again, welcome to everyone. We are meeting in meeting mode, not webinar mode, as you can see. So that means we'll be able to see each other, hear each other, and interact. I would ask that you keep your microphone muted and to put your questions into the chat. So what we're going to do is just add your questions and comments anytime that you want. And then Rhitu is going to be giving her talk, and then I'll be collecting those questions and calling on people to ask your question. So I'm very excited again to have Rhitu Chatterjee here. And as you were hearing at the beginning of this call, she is an alum of the Missouri School of Journalism and has just a really wonderful story about how she came to us. So Rhitu, I hope you're going to tell that story, a little bit of your backstory of how you got into the J School. But I would like to go ahead and turn it over to Holly Peipenberg with the Pulitzer Center now to officially introduce Rhitu, and we'll get started.
Hi, thanks everyone, and thanks Sarah. Yeah, so I know you're not here to hear from me today, but I did want to give a little bit of background about the Pulitzer Center in case you have any questions about what our partnership entails or the reporting fellowship. So we're a nonprofit journalism organization based in DC. We support more than 170 reporting projects every year on global and local issues. So on our website, pulitzercenter.org, you can take a look under the reporting issues page and explore the journalism we support by theme, including racial justice, indigenous communities, environment and climate change, public health, and many others. We also have a strong education program, both in universities and through K through 12 schools. On the university level, we connect journalists with college campuses in person and now virtually, as you can tell. And we award reporting fellowships every year to students from each of our partners. So if you're interested in learning more about that, I would definitely reach out to a faculty member to learn more. And once again, you can find all of our reporting and education, public event resources on our website at pulitzercenter.org. Now, though, we would love to hear from Rhitu, who is a freelance multimedia journalist, now based in DC, right, Rhitu?
Well, I used to be freelance. I'm a health correspondent at
Right.
NPR.
Oh my goodness. I'm so sorry. Yes, at NPR. We really need to update your bio.
Oh, yes. I will.
But she covers science, the environment, global health, development, and much else throughout her career. She's covered Indian girls trying to navigate a landscape of changing gender dynamics, young American boys coping with growing pressure to look a certain way, and a lone scientist battle to survive in a dying profession. She's drawn to stories about human experience during social, economic, and cultural transitions. And as you know, Rhitu is an alum of Mizzou, so I know she's going to talk more about that and her career more today. But I think she will do a much better job speaking about her career and accomplishments than I can. So without further ado, Rhitu.
Thank you, Holly. Thank you for that introduction. And Sarah, thank you so much for inviting me. I'm just beyond thrilled to be here. I wish I was in person, but this is amazing. This is sort of going to be one of my highlights of the pandemic, coming back and giving a talk at Mizzou. So thank you very much. Honored to be here and super psyched also to see Berkeley and Martha. I was Berkeley's advanced writing. I was a student at his advanced writing class, and which I absolutely loved. And Martha, as she mentioned, was instrumental in helping me decide to even apply to the J School. So I'll start with a little bit of my backstory, as Sarah suggested. So I grew up in India. I had a master's in biotechnology. My dad was a scientist. I studied science, and I came to Mizzou to pursue a PhD in genetics. So I was studying little tiny zebrafish embryos in the lab, trying to understand all the genes involved in helping their brains develop. So someday, maybe potentially, some of those, some of what I studied would maybe come in handy in understanding sort of diseases of brain development in humans. But very soon I started to realize, a year into the program, I kind of started to realize, well, I love science, but the pace of science and the pace of discovery, I don't know if this is for me. I sort of am missing out on, I was studying these like handful of genes sort of talking to each other and helping the very cool stuff. But I was missing out stories. I was missing out sort of more of science. It was just so hyper-focused and so kind of granular. I was starting to lose sort of touch with sort of the bigger science stories, how science was being used to understand the world around us, to understand humans. And so at the time when I was working at the lab, I'd spend hours moving little zebrafish embryos, which I had killed, to study them in the name of science. I would put them in this reagent and then another, and then put them under the microscope. So lots of hours in the lab, and the radio would be on. And often my lab mates would be listening to NPR, and I didn't know what NPR was, and that's how I got introduced to NPR. Sometimes BBC would come on, which I was familiar with because I grew up in a former British colony, so I was used to the BBC, and I was like, BBC was a big part of my life before TV took over. And so I started listening more and kind of started realizing how much I loved listening to the radio, the stories on the radio, as I was doing my work. And then it so happened that I started to look around to see, somebody suggested, oh, you can volunteer for a community radio station. And I was like, oh, really? And I, looked up there, went to their website, and they said, oh, we need help all the time. Everything from running over like mail to the post office to like rearranging racks and to whatever. So I showed up at their office one day and I said, hey, you know, I would love to volunteer. You know, do you have any work for me? I can, you know, spend a few hours a week. And the general manager, David Owen, said, well, would you like to be on air? And I was like, oh, on air? What do you mean? He said, well, you know, we need somebody to operate the board. So when you hear somebody say you're listening to 89.5 KOPN, your local source of news, whatever, it's usually a volunteer, at least at KOPN, usually students at KBIA, who's operating the board, switching between BBC to local programming to NPR. And I was very nervous, but I was also very excited. I was like, sure, if you think I'll be okay at it, I'll come do it. So once a week, I'd sneak out of the lab, really hoping my advisor wouldn't hear me on air. And I wouldn't say my name. So I was like, oh, he won't know. So 10 to 12, I would sneak out of the lab and go to KOPN and do like the station IDs and local PSAs. And I was hooked. And that was, again, 2 hours in a week where all I did was listen to what was on air. And at some point along the way, I got my own music show, which was overnight. I think Tuesday morning from 2 to 5. So at, you know, 11:30 or midnight, I would bike over in my little rickety bike and pick music, and they had a great music collection. But anyway, along the way, I was just like hooked on I really wanted to do audio storytelling. And my roommate at the time was actually a graduate student. She's Croatian, and she was a graduate student at the journalism school. And she literally dragged me by the hand and took me to Martha and said to Martha, here, she's interested in journalism. Can you talk to her? And then, you know, Martha told the rest of the story. And then I applied with much hand-wringing. You know, then I quit my PhD and switched the journalism program. And I haven't regretted it one day. So that's sort of my backstory. So right now at NPR, Holly gave you sort of a background of what I have been covering over the last several years. I used to freelance, and then before that I was with a show called The World, which used to be PRI's The World. I think it's now WGBH and PRX's The World. So it's an international radio show in Boston. I used to be based there and then in India for them. But now I'm at NPR headquarters in DC, and I cover mental health, which I feel very privileged to cover, because I think most people who are interested in the topic usually are covering health or other topics and have kind of, they tell me they have to sort of fight to make to be able to make room and get their editors to agree to let them do mental health stories. So before I tell you a little bit about how I approach my beat and the stories I cover, I wanted to give you a little bit of background on just radio storytelling, which some of you, I don't know if anybody here is interested or doing radio, but just some differences with just writing for the eyes versus writing for the ears, and some limitations and some advantages of the medium. So the big difference between, you know, whether somebody is watching something on TV or reading a book or a newspaper or something online versus listening to the radio is, for all these other mediums, people usually consciously make the choice to sit down, and they're usually all attention, right? You pick up a newspaper or you log on to, you know, you go to New York Times, you are making that active choice, and that's all you're doing. But the thing with radio is people can be doing 4 other things while they have the radio in the background. You know, like I said, I started listening to the radio when I was mixing reagents and pipetting lab chemicals, right? Or like I'd have it on when I was looking at zebrafish brains on the microscope. Most people, you know, have it on in the kitchen, like I do these days when I'm cooking or feeding my 1-year-old dinner. That's when, you know, it's Marketplace comes on. A lot of people drive, so it's a distracted audience, right? And so my job as a radio storyteller is to really, through whatever chaos is going on in their lives, with my voice in the background, I have to hook them pretty quickly and I have to make them listen, and I have to make them care despite whatever else is going on in their life. And then the writing has to be very conversational. It's for the ears, not for the eyes. And because of the constraints I outlined earlier, that it's a distracted audience, my colleague Marco Werman, who hosts The World, used to say, if you think of a story for like a print medium, the radio story is sort of like just the skeleton of the story. You can't have muscles, you can't have tendons, just the bare thing sort of holding whatever connective tissue holds the skeleton of that story together is the radio story. So not a lot of room for nuances or too many details or digressions. And even though as a science journalist, I look a lot at data, I look a lot at studies, I can't put in too many numbers. Numbers are obviously very important, like 50% of the population is struggling, or 30% is struggling with depression in the pandemic. That's an important statistic, but I can't burden too many numbers because the human brain just doesn't process numbers as well when you're listening. And what does matter is emotion, engaging human voices, and really, even when I'm talking to experts, having them sound, you can get all the backgrounds and the science and the detail from them, but you can probably explain it better than them. Get them to have some emotion, get them to, if you're doing sort of a straightforward science story about a discovery, get them to explain what makes them get up and excited about it, that excitement, because it's that human connection is what makes the audience really care and connect to the person they're hearing on the radio in the background amidst all the chaos in their lives. So engaging human voices and emotions are a big part of just radio storytelling in general, and it becomes even more important for mental health because then we are talking about the core of the story is really people's emotional lives, right? And I'll talk about that more. And when it comes to mental health, some of the factors, sort of things that really, just to give you kind of an overview of what kind of it's like. First of all, mental health, even though societally the conversation around, we are talking more openly about mental health, and perhaps that's one silver lining even of the pandemic, that I think since so many people, just almost even people who didn't have mental health struggles, are struggling emotionally right now, because it's so many months, a year of so much uncertainty, so much stress, so much anxiety. I think the conversation is becoming a lot more open, but it's still very stigmatized topic. And sometimes even medical professionals don't want to broach it. I just did an episode for NPR's Life Kit podcast on burnout, and physicians and nurses, and the healthcare industry is at very high risk of burnout, especially through the pandemic, but doctors still don't want to talk about it, even when it comes to their own mental health. So huge stigma. And the other thing is, even though I'm looking at a lot of studies, a lot of numbers to kind of get a sense of like, what do we really know for sure, or as certainly as we possibly can to inform our audience, the science is just part of the story. Because a lot of my stories are, and sometimes they're all the stories. So, I'll play you a little clip a little bit later about of a story that I did when, the former president was putting all the migrants coming at the border in detention. And I did a little piece on why mental health experts and psychologists and child developmental experts are concerned about the long-term impact of that detention on kids, even if they hadn't been separated from their parents. And then all you have is the science. Sort of, what does science tell us about the near-term and longer-term emotional, developmental, mental health impacts of this detention on kids, right? And sometimes it's just like, it is just a science story, but a lot of times what I end up doing is the science forms the backdrop, but it's a lot about what do we do about, how do we deal with people with mental illness? How do we help them? How do they get access to care? And what are the factors in society, in their lives, that sort of put them at a higher risk of mental illness or might have paved the way for their struggles with mental illness? And then policies become really important there, and often politics also becomes important based on sort of legislations people are pushing or not pushing. Or say, for example, this happens with school shooting all the time. Is it in one camp says it's mental health, the other says it's gun laws, and that's a lot of times like the truth is lost somewhere in that sort of political battle. So my job then is to sort of sort through that and tell a cohesive story. And I sort of have the luxury that I'm often not on the ground when a mass shooting happens. I can sort of step back and take a look at all we know from sort of decades of having experienced this and experts having studied this. And the healthcare system, the mental health care system, also becomes a huge part of the story, because a lot, just talking about of what science knows about different mental illnesses isn't it, unless we can figure out how to get people care. And in this country especially, and I can say the same thing I think from back in India as well, mental health care system sucks. There's no better way to put it. So oftentimes the stories are about both the problems with the healthcare system, but I also love doing solution stories. So a lot of stories are about new innovations people are coming up with, about finding ways to get the care to the ones who don't have access to it. And then the other sort of central character, especially in my feature stories, are often people's emotional lives, right? So you're talking about very, very taboo, stigmatized topics. And often, talking to somebody who struggled with this is asking them to put their most vulnerable selves out for the world to hear about, right? So it can be, and so my ability to gain a person's trust and get them to open up and reveal that vulnerable self to me becomes very important. So that's sort of kind of overarching view of kind of the medium that I'm working with and the beat that I'm working on. And then now what I want to do is I want to play you some stories, and then I can talk about how that story came about and how I decided to tell that story. So bear with me for a second. So the first story that I will play to you is the sort of quick piece on how mental health experts warn about the impacts of new regulations on migrant children.
And while Rhitu is getting some of these clips lined up, feel free to start putting your questions into the chat anytime.
Migrant children, as we've heard. They say experts have argued against the detention of migrant children, as we've heard. They say longer periods of detention could have a devastating impact on children's mental health. NPR's Rhitu Chatterjee has more.
Back in 2018, Sarah McLean spent 2 months interviewing more than 400 mothers at a detention center about the mental health of their children. McLean is a medical student at the Icahn School of Medicine at Mount Sinai in New York.
Overall, we found high rates of emotional distress in these children.
She says they showed symptoms like
wanting to cry all the time, wanting to be with your mom, conduct problems such as fighting with other kids or having temper tantrums, peer problems, so not having a lot of friends or only wanting to interact with adults.
These symptoms were far more common in the children who were recently reunited with their mothers after being forcibly separated from them once they crossed the US border. McLean also directly interviewed 150 kids aged 9 to 17 about whether they were experiencing symptoms of PTSD. Symptoms like
having flashbacks of trauma or nightmares about the trauma, also having negative alterations in their mood, so feeling depressed or sad.
She found that 17% of the kids had symptoms of PTSD and would likely be diagnosed with the disorder if they saw a psychiatrist. McLean and her colleagues' findings confirm what's been shown by researchers in other countries. Kristen Torres directs child welfare and immigration at First Focus on Children, an advocacy group in Washington, D.C.
Research by the Australian Human Rights Commission found that children in detention facilities are 10 times more likely than adults to experience symptoms of post-traumatic stress disorders, and that those rates increase the longer a child is held in detention.
And these effects aren't buffered as well by the presence of a parent because they too are stressed out and depressed in detention. Louise Zayas is the Dean of Social Work at the University of Texas at Austin and has conducted psychological evaluations of children and parents in detention.
Parents who are under the stress of detention not only transmit that stress and anxiety and depression to their children, but their roles as parents are upended.
Their authority is undercut and they can't comfort their children as well. Moreover, Zayas says most of these children have already been through a lot of trauma, from poverty and violence in their home countries to violence and other hardship on their way to the US.
And now we're adding additional adversity by keeping them in detention.
Research shows that chronic stress and trauma can hurt brain development in children.
It affects regions of the brain and functions that have to do with cognition and intellectual processes, with judgment, self-regulation, social skills.
And the longer they're held in detention, he says, the more likely that it will have a lasting impact on their mental health and development.
And it really troubles me that there will be thousands and thousands of children who will be scarred for life.
He says some of these kids might bounce back after they're released from detention, but many, he says, will need long-term mental health care to recover from their traumas. Rhitu Chatterjee, NPR News.
So in this story, this is pretty much sort of summarizing what researchers know, right? But as you know, I think there's maybe one statistic or maybe two pieces of stats there. Number of kids with PTSD-like symptoms and something else that the Australian Commission had found. But even there, like I have to get, so I remember my interview with the first author who had studied these kids in detention was like 35 minutes long, and she went on and on about, there was a lot of jargon, but I had to sort of cut it down to like, give me straight exactly what you saw in the kids, and you have to pull out those most succinct bits of more human sounding and less scientisty sounding tape to get that across. And even with the last expert, you'll see, I kind of had to push him to say like, what bothers you, right? So when somebody who's been studying these kids says, it really troubles me, like then that stays with you. That's the bit that you really connect, and that's going to help the audience sort of connect to why this is important and why that, I mean, you've heard a list of various things that can happen to kids, but ultimately, he sort of brings it home and saying like, this really bothers me. I'm really worried that what this is going to leave kids with. So that's a sort of more straightforward sort of summarizing of what the science says, sort of a story. Next, I wanted to play for you a 6-minute piece. And Sarah, we have till about another like 9 minutes, right? Before we go.
We have until 12:15.
Oh, but before you want to go to questions in about 10 minutes?
Oh, yeah. I mean, we'll be flexible about it.
Okay.
Yeah.
Okay. All right. So this is a piece about, so, in the last several years, we've heard a lot about the opioid crisis, right? And we've heard about people dying. We've heard about pharmaceutical companies. And having covered global health for a long time, I'm personally always been interested, particularly in women and children's health, because they're often maternal health and infant health are often sort of, they tell a lot about how well a community is doing. So that's something that's always interested me. And once this is essentially, so one of the things that's happened because of the opioid crisis that we don't hear a lot about is how many more kids have gone to the foster care system because one or both parents were using opioids. And that number has really shot up in the past decade as the opioid crisis is sort of sort of destroyed communities. I think you might have seen stories about grandparents stepping in and taking care of kids. But this is the other story. So the horrible, huge, looming story really was just how many kids are in foster care. But I told you that I really like solution stories. Even at the darkest times, I try, because that's what sort of gives me hope. And I think even as journalists, of course, our job is to sort of hold up a mirror to society and show all the things that are going wrong so that they can be fixed. But especially now, I think when we have such a glut of news and a glut of bad news, I think it is even more important that we tell these solution stories, not to sort of kind of undermine sort of the darker reality, but I often find you can tell compelling stories about the problem by even telling a story about somebody trying to come up with a solution, because the hurdles that they're facing often reflect the problem and sort of are more telling about what roadblocks we face in being able to solve a certain problem. Solution stories don't win a lot of awards, but I think they're just so important. And there's also, I think more and more journalists are recognizing that there's also the Solutions Journalism Center in or network started by a couple of New York Times journalists. But anyway, so this story was really about a mom, and she is definitely the exception, who was able, who had struggled with opioid addiction for years and would have totally lost her kid. Like, you know, authorities would come and taken her baby away from the hospital. But, and she's from Reading, Pennsylvania, but she was able to, certain people sort of saw this unfolding and sort of mom after mom and baby after baby getting separated. And so they came up with a solution to better help these women keep their babies and raise them. So this is a solution story that I will play for you.
That is Kelly Zimmerman, a 27-year-old mom in Reading, Pennsylvania, giving her toddler Jackson a bath.
Your little piggy toes are all wrinkly already.
Zimmerman was addicted to heroin for years. Many women in her situation end up having their babies put into foster care. The country's opioid crisis has only made this worse. As part of an NPR-wide project on parenting, NPR's Rhitu Chatterjee tells us about Zimmerman's fight to defy the odds and keep her baby.
For most of her life, Kelly Zimmerman felt alone and anxious. When she was a child and her mother suffered episodes of depression or had to work the late shift.
My mom worked at night.
When her friends wanted to come over.
What does your house look like?
And she felt too ashamed to let them see their buckling floor.
We didn't have running water.
Kelly learned to shut out a lot of feelings. Then, when she was 18, a boyfriend offered her a painkiller, a Percocet.
To me, I was like, oh, where has this been my whole life?
Kelly was hooked, first to painkillers and then
heroin.
For years, she was content to live, and she says maybe even die on drugs. But then, when she was 26, she gave birth to her son, Jackson.
Like, I was in love with him. You know, this is my baby. Like, it was like a good, overwhelming kind of, I don't really know how to feel type of feeling, like a lot of feelings feeling.
But Kelly knew that she and Jackson had a tough road ahead. She was a single mom and grieving. Her son's father had died recently from a heart attack. She was also on methadone. And so when Jackson was born, he suffered from opioid withdrawal.
Like tensing up.
And shaking.
I just felt like crap because I did this to him. You know, like I know what it's like to go through those withdrawals and just feeling like I want to die.
Kelly visited Jackson every day in the neonatal intensive care unit, and she made a promise to him.
I need to make this up to you somehow. If you have to be here, I'm going to be here.
She was determined to do whatever it took to get Jackson better and raise him herself. But on her own, the chances of doing this were slim. The year her son was born, 92,000 children throughout the US were removed from their homes because at least one parent had a problem with drug abuse. And Kelly worried that if she relapsed, her son would be taken away from her too. Valerie Chandler manages the Opioid Use Disorder Center at the Reading Hospital.
Okay, you're a new mom. You just gave birth.
She says, imagine for a moment what women in Kelly's situation are going through.
So you were using opiates, and now you know the hammer's coming. The county's coming to get you. You're going to lose this child, and you screwed up. Oh, and by the way, don't use drugs anymore, right? Your one coping skill is gone.
Drugs were Kelly's only coping skill. And while she was using, she pushed everyone away.
It hurt a lot.
Her sister Jessie Palmer agonized over her baby sister.
There's a couple pictures that always flash in my mind when I think about Kelly. One was at a wedding, where she was dancing with me, and I remember, I'm sorry, I'm gonna cry. Because that was always the picture that I would send to her when I would tell her that I missed her.
Jessie didn't hear from her sister over the years. And then came the news.
The darkest moment.
Kelly was pregnant.
What's going to happen here?
So she confronted her sister about it.
You're less than 3 months till you're going to have this baby. Like, what are you going to do? She was like, well, what's your plan? And I was just like, I don't have a plan. I don't know.
A plan. A plan to get clean, to get organized around a new baby in the home. Kelly knew she needed a plan, but she didn't know where to start. So she went to Reading Hospital and signed up for every service she could find. The hospital referred her to Burke's Parent Services Collaborative. Social workers there knew that without a plan, moms like Kelly can crumple under the stress. For many years, they had watched nearly every baby born to an addicted mom be placed into foster care. They realized they needed to help pregnant women like Kelly well before their babies are born. Christina Cortez was Kelly's caseworker, and she told her,
I'm here to help you.
But to do so, Kelly would have to agree to a meeting with the county's Children and Youth Services and her family.
She didn't like me very much around this time because she thought it was the stupidest thing. It was like a 2-3 hour meeting of sitting with my family, talking about my problems. Like, I didn't want to do that. Who does?
But she knew she had to do it because she couldn't bear the thought of relapsing and losing her baby. On the day of the meeting, Cortez says Kelly was nervous
and scared that her family won't embrace her.
But the family was eager to help, she says. They just didn't know how, and they didn't understand Kelly's addiction. So Cortez and her colleagues brought in an addiction expert.
And I think that was a pivotal moment for her family.
That's when they understood that her addiction wasn't a choice, but a mental health problem. Then the family and Kelly got to work to come up with a plan. Her sister Jessie says,
a plan? Yay. Now she needs us, now we have to be part of her plan.
The family then figured out things like,
who is gonna take Kelly to her appointments? Who's gonna watch Jackson if, I need them to?
Kelly finally saw that she had help. Reading Hospital's Valerie Chandler says society expects women in Kelly's situation to do it all on their own.
Like, we ask people to do these incredibly difficult things without any thought about where they really are.
And that, she says, just sets them up to fail. Jackson's now a healthy, rambunctious toddler with a big smile and a head full of curls.
That's your favorite.
Kelly has been clean for 2 years. She and Jackson now live with her parents, and she has a whole team of people standing by her, making sure that she and Jackson can stay together. Rhitu Chatterjee, NPR News.
Left foot, right.
So, that story, I'm wondering if anybody has any thoughts on it.
There's several questions in here that are kind of related to the story. Maybe we could start with that.
Yeah, sure.
So Hannah and Lily both asked questions related to stigma and reporting on mental health and how you develop sources. So maybe Hannah and Lily, could you each both ask your question, and then we'll let Rhitu respond to both of you.
Yeah, for sure. So my question was just kind of given that stigma and the vulnerability that's required for reporting on these kind of stories, how hard is it for you to get at that angle and get at that human source, and like kind of what does that process look like?
So that is a big challenge, especially I think when I'm trying to reach people who've never talked to the media. So, it's a little bit easier if if I'm talking, if it's like depression, anxiety, and somebody's already sort of they've taken on in sort of advocacy role, then it's a little bit easier. Than they've already put themselves out there and they've talked to the media before, they've told their stories before, so it's easier. But for somebody like in this story, Kelly, it was hard. I mean, the good thing was I found her through actually a clinic, and the story was initially going to be about sort of what helps moms from underprivileged backgrounds do well. And this was going to be a story about sort of group, when pediatricians see parents and their kids in groups. And then so the parents become sort of support from one another as well. And so Kelly was one of the more confident moms in her group. But then once I started talking to her, like the addiction became such a big part of the story, and she clearly had the help. So she was willing to tell her story, but it was gaining that trust. And even, I think when people also talk, especially like a radio reporter, I mean, you saw we got into some real, very detailed personal things, right? Like from her childhood, her mom's story, her, so that takes a lot of trust building. And so, and these interviews can be very emotionally exhausting. So I also like to, it's exhausting for them, it's also exhausting for us, emotionally draining. So I also like to spread things out. I think it's, she's never talked to a reporter before. And you could tell she's from a, she had a difficult childhood. Her parents are still kind of strong. They're amazing, but they don't know what NPR is. They're not your average sort of NPR listener. So there's extra trust building. And I also, because of how draining it can be, I also like to give some time, especially because I mean, if I lived in the same city, then it would have been different. But we actually did 3 separate trips. One to just establish contact and say hello, get the basic story. We didn't even record then. And then we had 2 other trips where we spent like a couple days with them. Then figured out that we had to talk to, like, not only was a family important, but all these other women in kind of the hospital were important. She had this caseworker that was important. So that usually takes a long time. And I'll tell you, I think one of the stories I sent you guys was about a kid who threatened to threaten violence, right? I don't know if you had a chance to listen, but in that case, it took me 3 months to even get a character. And this becomes even harder when I'm talking about minors. So I was talking to school officials, mental health experts, everybody's around the country, and they're telling me, yeah, we're doing these prevention efforts to prevent school violence, to prevent mass shootings. And it involves like listening to kids and helping them when they show these threats, make these threats. But because they're minors, their privacy and the sensitive issues, they don't want the student to be stigmatized. Almost everybody that I talked to, they said, yes, we're doing it. Schools that I talked to, they said, yes, we're doing it, but we can't put you in touch with anybody. So it took like me talking to the school psychologist 3 or 4 times. And again, we're not in the same city. He doesn't know who I am. He listens to NPR, but only to wait, don't tell me. That's his reference point. So it took me interviewing him 3 or 4 times before he could trust me, and he knew I wouldn't sensationalize the topic. I would treat my subject with sensitivity, and he put me in touch with not a minor, but a kid who was now 25 years old who would be willing to talk to me. So that's a big part of the work, and that's why my stories take a lot more time. It's so different from just being, talking to the experts is easy. I call them, I tell them NPR, they want to get their expertise out. That's quick and easy. I can make that happen quickly. But finding the right voices is really, really, and sometimes I'm talking about things like suicide, which is a big part of my beat. It takes a while.
Thank you. Lily, I know she kind of addressed your question, but is there anything else you want to ask or any comment that you have on that?
Yeah, I kind of wanted to tailor my question a little bit more because you did kind of answer part of it. But I guess I was wondering a little more specifically what kind of deadlines you're usually working with when you're doing these stories and how you balance that with, well, maybe not how you balance that, but just kind of like more specific strategies that you use to build up that trust and rapport and simultaneously extract these details for a story without seeming like you're just trying to extract a story out of a situation.
Yeah, so a lot of it is, just sort of, I think, recognizing that, like, approaching just a lot of times I have to sort of counter this image that people have. I'm this, whatever they have, idea they have about like a reporter coming in from the capital of the country, right? Like, or if they're in the current political climate. So a lot of it is just being kind of the human being that I am and connecting with them as a human, and just getting to know them before I start to like really ask about the sort of deeper details. And sort of there's a lot of sort of testing of the waters for me and for them. So it many conversations, and when they talk, and this sort of, it helps to have had years of radio reporting background, and I've been told even before I turned to radio that I am a good listener, so that comes in handy. Just listen. And a lot of times once people start to talk to you, because of the stigma, because nobody talks about it, they're also like dying for somebody to hear them out, So that's the other advantage of this beat, that once you get through to somebody, they actually want to talk, because nobody, they've been sort of keeping them inside. They have a lot of shame about it. They have a lot of sense of guilt about whatever they've experienced. Because of the societal stigma. So once they open up to you, and if you're compassionate, which is why empathy and compassion are so important on this beat. You have to be able to put yourself in their shoes to understand what happens. And I played the story because I think a lot of times coverage on, I think, on drug addiction doesn't really explore kind of the risk factors. And that's where my background as a science reporter comes in handy. A lot of the times people who are reporting on addiction aren't from a science reporting background. And you'll hear the way I set up Kelly's story, I talked about the poverty she grew up with, right? Poverty increases risk of mental illness. So I know that data. I'm not saying it that way, but I'm telling it in a very simple, her house. She had a lot of stress from just being poor. Her mom had issues with alcohol. That sets her up for a higher risk of addiction itself. So I put in that little detail there, and kind of how from a very young age, and I don't know if it quite comes across, but like the point was that her mom was also somewhat absent because she was, and when you have a mom that's has her own mental health issues, that increases her risk of mental health issues. And so that's where her anxiety sort of came from. So there is a lot of sort of background reporting on the science, on what the data says, but it's just presented kind of much more conversationally. I hope that answered your question.
Thank you. I see a few other questions I want to get to. I'm going to call on Jack, if you're there, Jack, to ask a question about your science background and radio work.
Yeah, my question is just with your science background, doing research and being in a lab, how do you think that's helped you then become a reporter, knowing what the realm of research and, kind of getting into the nitty gritty of like the data and what that's been like for your experience now reporting? And then also as a radio student at MU, how did you get into freelance work, and how difficult was that to get into?
Sure. So I will say the one big advantage of, so there are two things. There's one thing that's very common among journalists and scientists, and that's curiosity, right? I think both these sort of people who are intensely curious about the world around them in different ways, perhaps, are drawn to these professions. So I had that going for me. But in terms of data, the other thing that I think a lot of people who maybe don't have a science background, you don't need a science background, but I think I was definitely not afraid to look at studies, and I had some practice in reading studies, which I think people who don't come from a science background kind of need to build that. But I will say though, I had to unlearn a lot of what I was trained in a very small field. So, and now I end up covering about fields that I never actually studied. So I had to kind of expand that world as well. And in some ways, even in the early days, I remember when I was reporting on things like genetics and cell biology and stem cells and all of that, I had to kind of put what I knew in a box after a while, because I realized very quickly that I would try and sound like the scientist, and I would try and show off how much I knew. And then I'm not thinking like the reader or the listener. I'm trying to sound smart. And that's not necessarily actually helpful. I mean, you want to sound a little bit informed and like you've done your research. But when you go in and start talking to a scientist like a scientist, you just engage in a scientific conversation. You don't necessarily, I'm not asking the question like, okay, sorry, can you explain that in lay terms? Imagine like I don't have a science background. I met you at a party, like what does that mean? Like then they will actually take out the jargon. And like, I imagine I'm your grandmother. I'm very smart, but I just don't have your degrees. And I'm curious about the world. Can you just explain your work to me? So there was a lot of like unlearning or like putting behind what I knew. And so that took me I would say at least 2 or 3 years to sort of learn to kind of do that. So that was a limitation that I had from my science background. And you asked about freelancing. Okay, for freelancing, I didn't start freelancing until I had staff experience for at least 7 or 8 years. And I would say that was very helpful, because by the time I was freelancing when I moved back from the United States to India in 2013. And I already had worked in several newsrooms, and they would be my steady clients. I knew editors through the National Association of Science Writers, through Society of Environmental Journalists. And so I knew editors, and those contacts are really important. And I wasn't an unknown entity trying to pitch to people. So I had steady contracts when I started freelancing. So, my freelancing was sort of like permalancing sort of thing, where I had a contributing correspondent contract with Science Magazine. I had a contributing correspondent contract with The World. And then I had no contract, but sort of, I was a known entity for NPR because I'd worked there as well. So if you're thinking about freelancing, I would highly recommend actually getting a staff job somewhere, getting the clips, getting the contacts, and then launching into freelancing, which I know isn't that much of these days, it's just the job market is very different, although things have come back. So there are jobs out there, more than there were like 5 years ago even.
Thank you. That was really interesting. And I agree with that. We've been talking a lot in class about those professional connections and how important that is. Let's see. I see a couple of related questions here about dealing with PTSD. And I want to see if we could kind of combine those questions together. So from David and then from Courtney, if you could each kind of express your question, and then let's let Rhitu answer both of you. David, you want to go ahead?
Yeah, I was just scrolling back up to mine, so
yeah, no problem.
because mine was really more about like how these stories that you did emotionally impacted you, and what they did to affect and guide how you decided to write those stories. So I know, like with the one with the children in detention centers, all of the people that were giving comments and giving quotes in your story were professionals that work in the field, but they were coming from a perspective of observation as opposed to actually sitting down and talking with the child who is struggling with PTSD. Because I mean, children shouldn't have PTSD. That doesn't mean that doesn't happen, but I'm saying like that's not something a children should have to struggle with. So to sit here and see that that 17% of all of these children are struggling with that, and if not that, they have some other trauma that's that they're constantly facing every single day. How does sitting down and actually letting that sink in affect you emotionally, and then help guide how you decide to write that story?
And Courtney, let's have you ask yours too, because it's the flip side.
Yeah, so mine's a little more technical about the process, but how do you go about interviewing people with PTSD in a way that doesn't re-traumatize them, by kind of evoking those emotions related to their traumatic experiences? And are there any specific techniques that you use when going about interviewing?
All right, so I'll take Courtney's question first. Again, as I was there's a lot of testing of water. So, I will always tell outright if there are any questions you're uncomfortable answering, you don't have to answer it. We don't have to go there. And you can tell me to stop and we will do that. That's kind of at the outset, especially when I'm dealing with like real people struggling with real issues. That's always there. Like, and if I see them, it's a very interesting question. I remember years ago, I was in Sri Lanka. This wasn't a mental health story. It was a health story. It was about this kind of strange, mysterious epidemic of chronic kidney disease that was happening there. And I was talking to the wife of a guy who was very sick and he was away. And, I was being the radio reporter, like, how does this make you feel? And she was very, the trouble that I was having was she was very stoic, and she was answering in a sort of monotone, and she's just like barely, what I realized later, she was barely holding it together. And I did that, and she burst into tears and was angry at me. And she was like, how do you think I'm doing? She said, you reporter after reporter come in and you ask these questions. How do you think I'm doing? My husband's almost dying. Like, and I actually switched off my mic. And I know different people would do it differently. I think some would have kept the mic in their face. And this is one of the harder bits of the job, because I think as opposed to print where you can set the recorder down, I think that microphone sticking in your face when you're talking about sensitive stuff is like takes some getting used to. And I think not all radio journalists would agree with. Some might have kept the tape on and have used the tape. I just felt like she was right. And my story would make people more aware. I knew it wouldn't change her situation. I'd flown in, I was going to fly out. Her life was still going to be the same. Husband was probably going to die. And her dignity, her humanity, her strength was more important than my story. So in that case, I, step back. And so I think that's a line every journalist has to draw. Is your story more important, or is your humanity more important? And I kind of err on the side of my humanity, knowing that most of the time I'm talking to people who are very vulnerable, and talking about the emotional impact, David, like that just stayed with me and haunted me for a long time. It was, and that's again, like, it's a good sort of segue to your question, because I decided not to use her in the story and use somebody else who was more comfortable talking about it. And in general, how do these things impact me? It's hard, I will say. I just did a big sort of enterprise project looking at more kids attempting suicide during the pandemic, and actually talked to the parents of an 18-year-old who had just died 4 months before I talked to them. And and at the time, my son was 8 months old, so I was just new to the parenting experience and sort of extra aware as a parent, and perhaps a little more kind of sensitive, because I was so new. I am still new, a new mom. And so, there too, they were very stoic, they were just holding it together, and doing this interview, putting their story out there at a time when they were just kind of barely getting through their days without just bursting into tears. And so I didn't push them for kind of emotional tape. I used their story in the print section. They did say something powerful, very powerful things that worked better in the not print but online story rather than the radio story. And yeah, sometimes, like you talked about that, kids shouldn't have to experience PTSD, 17%. When I let that sink in, I feel outrage. And I have to get that story done and get that data, get those numbers out there. And I often have my colleagues saying like, oh, your beat is so hard. I don't know how you do it. It's like, it's what gives me, like, it makes it meaningful because I'm talking about things that don't get talked about. I'm getting stories of people that don't have their voices heard out there. And even if the process is hard, but I do have to sometimes buffer it with perhaps some more joy in my stories, so, and that's why I also sort of do these solution stories as well.
Thank you so much. That was really powerful. There are several questions here that are related to stigma, and I wonder if we could do the same thing where both people can ask their questions and then you can respond. So I have a question from Kate related to stigma, and also Rachita. Kate, are you with us? Would you like to ask?
Yeah, so from your perspective, how does your work reduce the stigma of mental illness? And I'm also wondering what your process of making sure that your stories reduce the stigma instead of perpetuating it is.
Okay, and then Rachita, you have a related question.
Yeah, my question is kind of related to the second half of her question. I'm just wondering, how do you balance in your stories discussing the risk factors of mental illness with the stigma that your listeners might carry? And how do you talk about those risk factors when someone might hear the story and think, oh, they should have just been stronger, or other similar thoughts?
So I'll take that question first. Actually, the Kelly story is a really good example of that, right? Like, I think, somebody like Kelly is really on the fringe of society, right? Like or like, I know the opioid epidemic has affected many people, but But part of, so when we were doing that story, we talked, my editor and I and the producer on this piece talked a lot about how somebody listening to her story would still basically think like, oh, you should have made better choices. Like, how could you keep using even though you knew you were pregnant? And that factored in a lot in our discussions. And that was actually the main reason we put that clip on the top of her bathing her toddler, because that's a moment that any parent can connect with. And even somebody who's not a parent can, it's kind of that universal, a parent bathing a child and them playing together. Those sounds are just, that's what humanizes it. So it's ultimately showing, the way I deal with the stigma is also kind of showing the person in their full, like, not just, the stories are about their mental illness, but they're more than just that, right? They have struggles, they have moments of weaknesses, they have their own kind of battles, and they have, when they're able to have, they have some agency. So when I'm interviewing Kelly, I'm also asking her, like, what are your fears? Like, she's like, I really didn't want to lose my son. So have a mother who's been an addict for like over a decade say, I don't want to lose my son. I want to raise him myself. Like, when you show that, like, every parent is going to relate to that. So when you show the person in their full, kind of all their dimensions, just by doing that, you sort of counter the stigma. And actually, talking about the risk factors, when you talk about the risk factors, it's a way to counter the stigma, because then you're telling people that the mental illness isn't their fault, right? That's where some of the stigma comes from, that I think people think that somebody who's struggling, ultimately there's this thinking like, it's like your fault you didn't get it together, or you're not able to cope, or but when you break it down as these are the risk factors they had, then you see better that they had the odds stacked against them.
Thank you. It was a good answer to that question. Let's see, there's a process question in here from Jared. Jared, would you like to ask your question about fact checking?
Yeah, since you work in radio and I've primarily been just working in print, I'm curious what your fact checking process is, especially before stories go on air, especially in regards to speaking with people who maybe have been in kind of emotionally traumatizing positions, or people who are key stakeholders in your story. Like, have you had an instance where you would share a detail of your story and they say, oh, I don't want this to run? How do you handle that?
I mean, somebody calls and says, I don't want this to run, if they come back and say that I've changed my mind.
Right.
I haven't had that happen. But I'll tell you the fact checking, it's, we don't, like, when I'm working on NPR's podcast, so I just did an episode on workplace burnout on how anyone can help their loved ones. It was on suicide prevention. So if you have a loved one who's struggling with suicidal thoughts, how can you support them better and kind of help prevent suicide? For NPR's shortwave podcast, and they have a fact checker, and they will go through the script and they will point out and say, hey, can you add a link to where's the study? And but on the radio side of things, we don't have that luxury. So some podcasters do have that. Otherwise, it's just me doing fact checking along the way and just making sure before a script goes on air, whether it's, so when it's somebody's life story. So for example, Kelly's story, I'm talking to Kelly, I'm talking to her sisters, I'm talking to her mom, her dad. So multiple corroborations, right? And I only use the bits that I can find corroborations on. And then people who've helped her. But otherwise, what experts say, I'm always sort of keeping track of studies, like like reports. And just before something airs, I just have to sort of make sure I know what a particular stat or research shows, like what that is. I sort of have to do it on my own. It's kind of built into the process. And for features, obviously for news stories, quicker turnaround stories, it's harder to do. Somebody had a question about pace of work. Lily, was that your question? Balancing, or was it Hannah? The pace of work that I don't think I answered.
I think that was Rochita maybe actually asked that in the chat, but my question was a little related to that.
Yeah, I'm lucky I don't always have to be on air all the time. I have a little more space and time because just the beat doesn't have a lot of breaking news. But on average, I'll say I usually do like 2 quick turnaround stories, which take me 2 or 3 days to put together, maybe 3 to 4 minute piece, while I'm working on something longer, which is 6 to 7 minutes max. So like right now, I was working on this 2 different podcasts, one a shorter version and a longer version. And then last week, while I was working on them, I took like a day and a half to do like a 3-minute piece on Morning Edition about a new report on stress in America because of the pandemic. But a lot of my other colleagues are doing much quicker turnaround stuff.
Thank you. All right, we only have 2 minutes left officially. I'm going to let Martha ask the last question, and then Rhitu, before you go, don't forget to give the students a tad of career advice.
Stay in touch with each other. This is actually something that Berkeley really drilled into us, and I really appreciate, and I'll pass it on, is that stay in touch with each other. You will be your friends' mutual cheerleaders and supporters for the rest of your careers, and stay in touch with your professors as well. And I will say, though, I'm so thrilled to be here. We're also very sad that we lost Scotty a few years ago. He was my advisor, and I wish I'd stayed in touch with him. So stay in touch with your professor, stay in touch with each other, and build those relationships as you go along with sources, with the people in your field. And that's what will keep you through the ups and downs and the crazy ride of the industry. So yeah, thank you so much for having me. This was a blast. Great questions. And I'm so honored to be here and talking to you all.
That was fantastic. And Martha, you didn't quite get to ask your question, but you don't need to. Okay. All right. It really was wonderful, Rhitu. I feel like we could have talked to you even so much longer, and it was really helpful to hear concretely how you handle some of these specific situations. I think the students are going to take away a lot from that, and we will all be listening for you on NPR and other places that we can find you. So thank you so much. That was
Thank
really
you for
cool.
having me. It was a real pleasure. Good luck to you all.
Thank you.
Okay, bye-bye.